Chief Executive Officer at Top of the Line Healthcare Staffing. I am a native of New Jersey. I've been a resident in North Carolina for 20 years. I have an amazing husband and 5 beautiful children.
Thank you all for attending this extraordinary event, and tonight we are taking the time out to thank our nurses for all the care they have provided to all the patients, friends, and families. We dedicate this night to celebrate your commitment, your compassion, your perseverance to providing top-of-the-line health care to all patients.
Say breakthroughs in the room.
Breakthroughs in the room.
It's yours if you want it. Anticipating.
Always has worse going on than you do. They always have more going on than you do. And if you look at it like that, you will understand that compassion comes automatically.
Went ahead, you apply for your EIN, you got that first with your company name, and you go to the state level to apply, and it's no longer available. Now you have to do additional paperwork just to try to get everything balanced, right? We are doing a Make the Call to Get the Client challenge. It's a 5-day challenge, and I want you to be a part of it. If you are a healthcare staffing owner and you are suffering with getting clients, hospitals, nursing homes, whatever your niche is, whatever. We adore each other. We love being with each other, right?
No, I adore it. I enjoy it. I love it.
I don't know what you're going through, but we stopped by to tell you that what's in front of you is bigger than what's behind you. Your destiny, your promise, your future. You might as well shout before you get it, because God sent me here to tell you that what he has for you is gonna be big. That it's my season.
That it's my season.
You ought to declare that over your own life. Say, I believe.
I believe.
Go. And you want that person to have that integrity, that professionalism when the door is closed, because that's what matters. If you're diabetic or you're diabetic, it's a chance that you might lose some type of sensation in your feet. So you always want to touch the water when you get into any type of bath water, when you're immersing yourself in like a jacuzzi or anything.
So how do you see your journey from that point in time till now? And what is it now that you are aiming for? What is it that you seek for yourself?
So right now, I'm just seeking to touch medical professionals nationwide, because, in global accountability kicks in, and that is what we have with our medical professionals. We make sure they are all of that when the door is closed. So
That's awesome. And
that matters most is your family, your health, and your happiness. You have to choose happiness over anything. And my husband, I love him when I say, look, you happiness over anything. Wait, don't go anywhere. Somebody asked a question. Oh, it's a good question. This is a good question, y'all, and I'm about to answer it, so don't go anywhere. I'm about to answer this question. I got you.
All right, y'all. Let's get to it. We got 15 minutes on the clock, and I want to make sure I respect y'all time and my time as well. Y'all, we on episode number 140. All right, why do I go live Monday through Friday, y'all? It's simple. You keep messaging me, you email me, you text me, you what else we got down there? DM me, call me, asking me questions, and when you ask me these questions, y'all, I answer them. Okay, so keep emailing me, DMing me, calling me, texting me, asking me these questions so I can answer them, y'all. You can catch me live here at 12 p.m. every day, Monday through Friday, live, giving you the answers and giving you the questions, that the answers to the questions that you ask. And then on Saturdays and Sundays, you can catch a recording. Literally, I mean, you know they can see in the background, right? I just want you to know, like, I have no filter up. Okay. So 12 p.m. Monday, Saturdays and Sundays, and literally you can catch a recording. So ask the question and then you can catch a recording. All right, let's get to the question, y'all. What is this is a great question. Episode 140, the best healthcare staffing software. All right, so the best healthcare staffing software. I give you 3 things on what I think is the best healthcare staffing software. We got 13 minutes on the clock. I'm gonna try to bring it down to about 4 minutes, and then we're gonna go into the other stuff. All right, so the first thing that I always suggest for my students to get is a scheduling software, right? No matter what your software is, when it comes to scheduling, you need a scheduling platform that is going to allow you to schedule your medical professionals seamlessly. So your medical professionals don't get a headache, your clients don't get a headache, right? And you're like, Elisa, why are my clients getting a headache? Because based on the client relationship you have, your client may use your scheduling software to be able to staff your medical professionals, right? So one of the things that you can allow your client to do is get access to your system. So now they have access to your medical professional and they can see, hey, this is the medical professional I need at this time. If I need somebody to come in as an emergency, their scheduler can call as well as your scheduler can call. So it allows you to share the responsibilities of that medical professional, right? Your schedule is very, very important because it also allows your medical professional to know when they're working, when they're not working. It allows them to pick up shifts to work, right? Based on your client's needs, your scheduling system should have the flexibility to literally schedule multiple facilities, right? So based on how your medical professional is hired, each facility should have their own schedule. And each facility that has their own schedule, that medical professional should have the requirements to get onto that schedule. Now, I'm telling you, as a healthcare staffing owner myself that's doing this, do not put your medical professional on every schedule that the facility has, okay? Because there are some platforms that literally that medical professional will pick up at that schedule and it won't carry on to the whole schedule to see that, hey, that medical professional is working at this building, that building, this building, that building, this building, okay? Make sure you get the particular platforms when it comes to scheduling software that shows you, like TeamBridge. I see it right here. TeamBridge is what I suggest all the time. Like TeamBridge, that shows you, all right, this medical professional, you look at the medical professional and it shows you this medical professional is picking up at Duke Hospital, UNC Hospital, and also Wake Forest Hospital, okay? It allows you to see that this medical professional is picking up, specifically TeamBridge, at these multiple hospitals, but it doesn't allow the hospital to see that this medical professional is picking up at these other hospitals as well. Okay, so it's almost like a blackout. It lets them know that they're not available for those days, but this is what they're doing in your building. Okay, so TeamBridge, I always suggest TeamBridge to people. Y'all get with TeamBridge. Reach out to me. Comment TeamBridge if you want to know more. I will send you the person that I work with when it comes to TeamBridge, so I can get an affiliate. You know, your girl need an affiliate, so I could get an affiliate and you could get the help that you need. But if you are building a staffing agency, you definitely want to have a scheduling system that is going to be flexible for not only your clients to see, but also for your staff to see. Y'all, everybody walking in the background like they're not being recorded for life on this video. So it's okay. All right. So definitely get a scheduling system. The next thing we're going to talk about, y'all, what is the best healthcare staffing software? One of the best healthcare staffing software, y'all, is ADP. ADP to me is a payroll company, y'all. I absolutely love ADP. They are a huge payroll company. They're almost number one in the industry. And I say almost number one because I haven't done the research to see if there's somebody that is number one in the industry. But in my eyes, they are number one in the industry because they have so many different things that you can offer your staff, and they make you look like you've been in business for a very long time. And the thing that I love about ADP is they meet you at your level. So if you can't afford the $10,000 a month plan that they have, then they can make it and fix it for you. Get a $2,000 a month or $500 a month, right? So they're very, very flexible. And because they've been in this industry for so long, they have the payroll company set down, right? So ADP is the payroll company. If you are working in a healthcare staffing agency, please do not do your payroll yourself. Save yourself the headache, right? You cannot do your payroll yourself and talk about expansion and growth. Get a company that is already established with all the banks, with all the apps and all this beautiful stuff, all right? And utilize them as your payroll company. One of the things that I absolutely love about ADP as a payroll company is when you are in healthcare staffing, one of the gems that they help you do is workers' comp, right? So if you are a brand new staffing agency trying to start, you need to talk to an ADP rep to see if, guess what, my state won't give me workers' comp because they say I'm too brand new or because of whatever the rationale is. ADP got some years on them, so you can potentially get workers' comp through their plan and pay your workers' comp through their plan. So one of the things that I absolutely love about ADP is that option to do the workers' comp with them. Again, Alisa didn't notice when she first started her agency, but now she knows, right? So they'll have a workers' comp specialist talk to you. They'll help you to code it right, y'all. Workers' comp is a code. So they'll help you to code it right so you are not overpaying for the services that you need based on when you need to get your medical professionals covered. So ADP also has it where they can pay your staff weekly, and then your staff can opt in to get paid daily with them through a program that they have. So you don't pay ADP daily. You pay ADP monthly or weekly based on your payroll schedule and however you set it down. But your ADP makes it a contract with your medical professional that literally says, we can pay you daily, but you're going to pay this percentage for us paying you daily. So it all comes out of the payroll that you send to that to ADP, and ADP now works directly with your staff based on daily pays and however that interest is. So I love ADP because, again, if you are a brand new staffing agency and you are in this business and people are like, well, it's staffing agencies that get paid every day. You're right, it is. But I can't afford that as a brand new staffing agency to pay you every day because I don't have the money. I don't have the funds coming in, right? You talk about 30 to 45 day invoices that I'm waiting on. So with ADP, it makes you already compete in the game with the big wigs like Aya or Favorite Healthcare Staffing, right? So it helps you to compete with them, all right? So definitely for a healthcare staffing software, ADP is something I suggest. Y'all, this is Salesforce, Sales Workforce. I think it's called Salesforce. For some reason, I feel like it's called Salesforce, but I'm going to leave Sales Workforce in there, but I believe it's Salesforce. All right, so the best healthcare staffing software I suggest to use on the recruitment side and account management side is Sales Workforce. I just want to say Sales Workforce for some reason. And the reason why, because it has a CRM system, and it literally, which is CRM, Client Relationships Management System, okay? So, or customer relationship. Some people call it a customer relationship management system. It allows you to get organized. So when you want to get organized in your business is when you are sending out emails to your clients, when you are sending out contracts to your clients, potential clients, and clients that you already have, right? When you're doing email blasts to people, right? So the Sales Workforce helps you to get this organized. Sales Workforce even goes above and beyond, and it can have your number. You can add your number to Sales Workforce and literally have people dial automatically. So that cuts out on the sales time because that matters too, the time it takes you to call one client to the next client. And this is what I love Sales Workforce because it makes you look like a very expensive company. Now, I'm not going to lie to you. Sales Workforce, I don't know if they meet people on different levels. So I can't say that. I know that when I was on the level that I was 2 years in, I needed some type of CRM system. When they brought this up to me when I first started, I'm like, I don't know what y'all talking foreign language. But what I'm saying to you, as a brand new staffing agency, get some type of CRM system. A free CRM system that you could get is HubSpot. So that's HubSpot, and HubSpot actually works with Sales Workforce or Salesforce. So you can grow into the free. You can start with a free system and then grow into the paid system with HubSpot. And HubSpot is cool. I have no issues with HubSpot. They just advertised to me later after I did Salesforce, and I just love Salesforce, right? So the great thing about Salesforce again is it integrates with a lot of stuff, so you can make everything seamless. So if you send one email out to your client, then you can send a bunch of emails to that client. You can schedule emails up to, I believe, 6 months on Sales Workforce to go out to your clients. All right, y'all, it's 4 minutes. You want that game? We are literally doing this game on Friday, y'all. We having a workshop. Definitely tap in. It's only $497. We are targeting clients. You're going to get all of this game that I have that we've been doing for almost 3 years now. May of this year will be 3 years. So May 4th will be 3 years that I've been open. I'm super, super excited. I just can't express this enough. I believe as of January, November of last year was a whole year that my consulting company was open. So I'm just, y'all, I'm telling you, we're killing it. All right. So as of May, we'll be out 3 years in. Hallelujah. That means we get out of the high bracket for workers' comp. Hallelujah. I'm so excited. Hallelujah. Okay, let me keep going. All right, so we done did all three. All right, episode 140. Y'all, best healthcare staffing software. Make sure you get into that program. First one is going to be TeamBridge. That's the scheduling. The second one is going to be ADP. That's your payroll. And then we got Salesforce. I believe it's Salesforce. I don't know why I'm leaving Workforce up here. I think it's Salesforce. Salesforce, that is your CRM system to help with your recruitment and account manager. Y'all, as always, I absolutely love y'all. Here we go. Why do they call me CEO 3 times? Because everybody's a CEO in their life. You either bossing it in life, you bossing it in business, you bossing it in at your job, right? So either way, no matter how you're bossing in life, you do it at minimum of 3 times. Y'all, I call myself CEO 3 times because me and my husband had 3 companies. The first company we have called Top of the Line Healthcare Staffing, where we staff medical professionals in hospitals, doctors' offices, and nursing homes. We have TOTLHS Heart to Go Inc. This is our nonprofit. This is the nonprofit that takes care of our medical professionals. Then we have The Real Elisa Applewhite Consulting. It has brought you questions and answers with your CEO 3 times live every day, Monday through Friday, 12 o'clock, where you can catch me live answering your questions, and Saturdays and Sundays at 12 p.m., where you can get a recording. Y'all, we are literally helping everyday people build a healthcare staffing agency from scratch, and they're getting clients. They're getting big clients too, like big clients. All right. Then we help everyday medical professionals to learn additional skills like ICU skills, ER skills, so they can advance their practices and go into these specialized areas. Y'all, we have partnered with schools where we go into the school system and partner with kids where we teach them about credit and also building a business, and just finding out what's going on with them in their current life and seeing how we can mix and mingle with that. Y'all, we have a book called Make the Call to Get the Client Book. Buy your book. And we are doing workshops, y'all. This Friday, we do a workshop where we teach you how to get the client. We ain't got no time for nothing else but to teach you how to get the client, right? So it's 100% free for any student that has taken, that has, you so funny, Carlton, that has literally taken our services. Anybody who has purchased our services is 100% free for you to show up, but you have to email us so we can put you on the roster. If you do not email us, you cannot get in, right? Can't get in, period. All right. So literally, I'm super, super excited about this consultation business because it is growing. Y'all, we do public speaking. We do everything in this business. Like anything to let people know that God is real at all times is what we do. All right, so follow me on all social media platforms, y'all. I want you to go to subscribe to my YouTube channel now, right? So The Real Elisa Applewhite. Again, that's The Real Elisa Applewhite. Again, that's The Real Elisa Applewhite. All right, go subscribe to my YouTube channel now. Go at this present time and subscribe to my YouTube channel, y'all. I don't even know if this is live right now. I got a message from StreamYard saying Facebook and Instagram was down at the present time, but if it is live, right? Then there you go. Go subscribe to my YouTube channel now, y'all. March 8th, y'all. March 8th. Let's do this. All right. We are literally doing the Make the Call to Get the Client workshop where we are teaching you how to get the clients. We ain't playing no games. Like this workshop is Friday, March 8th from 9 a.m. to 1 p.m. Be in the building because we are taking the time to give you our expertise on how to get clients, y'all. We ain't doing no PowerPoints. We ain't doing no slideshows. We doing straight implementation, period, right? Straight implementation. We are getting to the bag. I ain't got time to be having y'all reading stuff and doing stuff. I need y'all to do, right? So it's be, do, have. This is going to be the do section. These workshops are only for doers. So come through. And if you're not a doer, you need to be in the building because we are going to make you do. All right. So you already being that owner. We're going to make you do. All right. So you can have like that. All right. So make sure you register. Y'all go here to get your tickets today. www.therealaac.com/workshops. Again, it's www.therealaac.com/workshops. Y'all get into the game. Like your girl is trying to give it to you. She's trying to give it to you. But as always, y'all, I absolutely love y'all. I cannot express this enough. Tickets are only $497. So still, I don't even like saying the price. The reason why I like saying the price because it reminds me of how much money I'm losing. So I don't like saying the price. Just go to the link. Okay. So either way, at the end of the day, y'all, I absolutely love y'all. I cannot express this enough. I absolutely love y'all. Me and Carlton gonna go live a little bit later once Facebook and Instagram start acting crazy. But we're gonna go live a little bit later to listen to you and to talk to you. And you can ask us a question. We're gonna answer for free. That's crazy. But we are. Listen to what I'm saying to you. I love you. I absolutely love you. I adore you. I'm so glad that you're here. I'm so glad that you woke up this morning. But I'm telling you. My husband, my kids, my mom, my dad, my friends. Now, nobody in this universe loves me more than God. And the reason why I know that is because as a medical professional, I have been at the bedside of so many people who lost their lives and so many family members who cry and say, Lord, if you just give me one more day with them, if you could just wake them up, I just want to give them a hug. I just want to tell them I love them, right? And they couldn't. They could not. All right. God loves me so much more than any human being alive because for some reason, God woke me up again today and said, have life. So you might be amongst the people that love you and go serve my people. All right. So I absolutely love you. I am so glad that you're here. What I'm saying to you is go out and build a relationship with God because God absolutely loves you. And there's nothing that you will do. It's nothing that will sustain. I don't care what it looks like until you have that relationship with God. So go out and build that relationship with God. Absolutely love y'all. I'm going to leave y'all. A lot of people that you get access to in the business world, they give you information that you can utilize, you can execute. That's the thing about it. People don't want to execute. That's a good question. Why don't we execute, right? So you execute it and you gain some type of profit in your business for it. You have to gain some type of proximity to anybody that is on the next level. And hopefully they're making way more money than you, right? Their vision is huge. And it can be an inspiration from anyone that is making more money for you, right? Steve Harvey said this thing the other day on his show, and it hit me like a ball of bricks. I've heard this before. And it was, if you are the smartest person in the room, it is time to go to another room. And when you have proximity to people, you will find out that you are not the smartest person in the room when you get into the right rooms.